CRT planning is a software for multimodal image fusion for the planning of cardiac resynchronization therapy. Cardiac resynchronization therapy, or CRT, is based on the insertion of electrodes in the right atrium, in the right ventricle, and in the left ventricle through a vein. It has been demonstrated to be highly efficient to treat patients with desynchronized failing heart. However, there is still around 30% of the patients who do not respond to the therapy. So there is a need for the identification of the optimal pacing sites. Some characteristics have been demonstrated to be related to the response: a delayed mechanical contraction, the absence of fibrosis, a delayed electrical activation, and finally, we also need the anatomy of the ventricles and the veins. This information comes from different imaging modalities: echography, cine-MRI, late gadolinium enhanced MRI, electroanatomical mapping, and computed tomography. And so there is a need for multimodal cardiac image registration and fusion to plan CRT, and this is the goal of the software CRT planning. The main window of CRT planning enables to identify all the imaging modalities for one given patient. Here, computed tomography, MRI with different sequences, and echography. For each imaging modality, we can open a dedicated interface. For example, here in CT, it enables, of course, to visualize the images and to process them in order to extract the structures of interest. So here, the left ventricle and the veins. If I go back to the main window, I can open the interface for cine-MRI. Cine-MRI is a dynamic acquisition enabling to visualize and characterize the motion, the contraction of the left ventricle. And so we have also the tools to segment the left cavity. LGE MRI, late gadolinium enhanced MRI, is used to segment, to characterize the tissue in order to segment the fibrosis. So here you can see the myocardium in yellow and the areas of fibrosis in green. Basically, all these images are not registered, and we have developed a registration workflow in order to map all these images to the CT. Once this registration has been performed, it enables to visualize the anatomy from computed tomography with the veins, which are of primary importance for the implantation, and projected on this anatomical model, we can project so the other information coming from the other modalities. For example, here's the mechanical delay from echography to the echography, and here the presence of fibrosis from late gadolinium enhanced MRI. Based on this fusion model, the clinician has all the information of interest in order to identify the potentially most effective pacing sites, and so in order to improve the outcome of cardiac resynchronization therapy.